We are delighted to welcome Dr. Arunaloke Chakrabarti as our inaugural speaker of the newly formed ISHAM series, Pioneers in Mycology. Our guest, Dr. Chakrabarti, is director of the Dodhadari Burfani Hospital and Research Institute in Haridwar in the northern Indian district of Uttarakhand. Earlier, he worked as head of medical microbiology at Postgraduate Institute of Medical Education and Research in Chandigarh, the premier institute in India. Rather than having Dr. Chakrabarti give a lecture, we decided it would be more preferable for him to engage in a conversational type of interaction. So, Dr. Chakrabarti, we are so excited to have you as our speaker and are looking forward to learning about pioneer work in mycology.
Thank you. Thank you.
So, as a first topic that our audience will be interested in, how would you describe the field of medical mycology when you started, and what drew you to the study of fungi? Because some think it's a niche area. And so what are the opportunities, what were the changes and the challenges at the beginning of your career?
Thank you, Dr. Oliver Cornely. I was doing post-graduation in medical microbiology at this Postgraduate Institute Medical Education and Research. During 1983, while I was presenting a journal club, and in the journal club, there was a very interesting article. That time, nobody knew what is AIDS. It was said that one of the patients, suddenly, he had both esophageal candidiasis, then there was lung having got histoplasmosis, and there is also pneumocystosis, and along with that, there was also invasive aspergillosis. I was imagining how a person who was completely healthy before that could have such situation in this. And when I presented in the journal club, my colleagues or my seniors and also my teachers, they were not knowing much about fungal disease. And they were very surprised about it. In case of the medical microbiology, the discipline of mycology was very small and short in that sense. There was not much interest because people used to know it as, say, a skin infection or some endemic infection which have been there, like histoplasma, which is common in case of India, which is being there. But this particular situation really made me very much puzzled, because I came to medical microbiology in a plan to do some good research in the field. So I started thinking this is one area where possibly I can put my foot and try to understand. And by the time when I graduated or post-graduated from that particular discipline, AIDS was already known, the virus came to be known by that time. And there was really, in case of India, we found there is almost an epidemic of AIDS happened. Now, at the Indian scenario, very interesting is that in 50s and 60s, there were many mycology laboratories. And those laboratories are usually manned by one person only. And by the time when I came into this field, those persons already retired. And because it was a one-man show, all the laboratories without. And there was hardly anything which was there, which we could fall back, do research. Even in my own institute, when I became the faculty or become lecturer, I was the only person who is in this field. I have got only 2 technicians, that's all. And the laboratory was very primitive. There is nothing in that sense which we could do fallback. We were doing only direct microscopy culture like this. So I felt that if I plan to do something in this area, possibly it can help. And moreover, the whole country, there is no mycology laboratory almost. Only there was in Delhi, one laboratory was there. So by that time, my director called me. He said, we heard that you are a hardworking person and we need a person in case of the virology laboratory. We'll send you to CDC for 2 years training, and post training you take over the virology because that's really a challenge in this country. I said, I am taking another challenge in case of fungal disease. And he doesn't know about, or he didn't know that time, what is the importance of fungal disease. He said, fungal infection is not important at all. You will not get any good study out this case. So it is better you go into virology. But I said, is it an order? Or if I've got an interest which can decide about it? He said, no, 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 I don't give order. And if you want to stick to mycology, you remain in mycology. So I remained in mycology, and my teachers all said that you have done very big mistake, because if the director desires something and if you have not followed it, that means you have got a real problem in future life. But that director was very nice person. He never came into my career building in path. There was no problem which I faced after this. So this is the major issue of years which have brought me into the field of medical mycology, because that was the time when I just wanted to choose a discipline where I should work.
Thank you very much. That's highly, highly interesting. And apparently you had good mentoring and you had a good boss who did not force you too much into the direction that you didn't feel comfortable or the most needed of. So when we see what was developed over the years, then it is of course the question on developing infrastructure, because what you describe is not infrastructure, but now there is infrastructure across the country. So how did you develop infrastructure at your place, and how across the vast country of India in terms of lab development, training of manpower and developing people, research infrastructure, and diagnostic mycology infrastructure, to just name a few. So maybe you can expand on that.
That's a very important question which you have asked me. In case of my institute, we are a bit lucky. The reason was we do have 3 clinical pathological case presentation every week. And those clinical CPCs, which is being called, one of the clinicians present the case, and then the pathologist finally give the diagnosis. And surprisingly, in our institute, it was seen that out of the 3 cases who died, one of them died because of invasive fungal disease. That made awareness amongst all the clinicians across the discipline. And that time, there was the symposium had been thought about by the director. He said, okay, no, it was Dean who thought about it. Dean said that, okay, let's have a symposium in fungal infection. And I was also there as a speaker. So when I presented the scenario of this across the world, it was really revealing that this is very important challenge. And that helped me. Since then, whenever I was going to the director and asking that I need another technician to having this facility built up, he was supportive. So this is because of this awareness which came into our institute, because of the CPCs which were being conducted regularly. And we have possibly highest number of medical autopsies in the world. And this is not medical autopsies. And that really helped to a great extent. Then I started thinking that, okay, I then acquired another faculty in my discipline. And then also from the 2 technicians, I could go up to 6 technicians. Now there are 8 regular technicians in this. These were very important steps one by one. Then I thought that I should try for a center for advanced research, because that was giving good funding from Indian Council Medical Research. So I approached that particular program, and I was very lucky. I was always being blessed. I don't have any godfather in my life, but always being blessed by somebody. I think it is the sincerity which brought me that scenario that people really liked and really helped. Like in case of the Center for Advanced Research, the money which I asked following the whole day presentation, and after going through it, the chairperson who came to review my project said that you cannot do within this money. So he raised 3 times of the money which I have asked for. This is unexpected which happened in that scenario. But at the same time, I was starting thinking that I should have WHO collaborating center. I was trying repeatedly, but nobody paying any attention in WHO, and they were not doing anything. But the CRO, our is the Southeastern Asian country, which is coming under CR in WHO. That is the regional branch which is there. The Director General of CR, he came to PGI in our institute. And by that time, I told my director, sir, I was trying for getting this particular program, but somehow WHO is not giving me this. He said, why don't you come during lunchtime? So during lunchtime, when I was there, he introduced me as like I am a god in the field of mycology and gave me a lot of input in that sense. And then the person said, okay, if you are saying this is so important, let me think about it. Then 2% came from CL. They said, how are you convinced about this aspect? He said that you have to have a WHO collaborating center on fungal disease. So they suggested me that if you can put it under the head of HIV infection, that becomes easier for us to make it. So this is one way. I think that is the only WHO collaborating center in the world having all portfolio of diagnosis in fungal disease. So that was the second achievement which we had. Third thing is that I was thinking that if we have to have research in the field of fungal disease, we need a culture collection. This culture collection, especially of the clinical isolate, would help in improvement of research. So again, I approached Indian Council Medical Research for a big project on National Culture Collection Facility, which was again supported. So I'm saying you, these are the step-by-step really helped me in building up the laboratory. That's really helped me in going up to 4 faculty who are working in fungal disease. There are so many other staffs, then research projects, everything came simultaneously, one by one. These are the issues ultimately helped us in development as the best laboratory in case of our country. So that was the major issue. And along with that, simultaneously, we are doing the training program. And we were doing the training program in case of the summertime, especially the faculty and the scientists, they were trained across the country. And in the winter time, the same laboratory, the technicians are being trained. So it develops a nucleus in different places of our country, in having got multiple laboratories in our country growing up, it helped in a big way in having multi laboratory facility in case of this country.
That is very impressive, and I can already see quite a number of lessons that we can learn from the expertise and from the decades that you are reporting to us. So, if we could speak about building your research program and, well, the importance of communication and collaboration already, it's a red thread, I guess, communication skills and collaboration through all what we hear today. So please tell us about the process of getting all this accomplished, and what are your thoughts on the value for your the trainees and the mentees and collaborators So can you comment on the importance of collaboration?
I would say that at the very beginning, there was no money in case of the fungal disease, no funding, nothing was there. Uh, so when I thought of doing research, I felt that some epidemiology research, if we start going with, that would help us in knowing about the disease across the region, and that would help us in taking care of certain disease which are more India specific. So, I thought of mapping of fungal disease in that whole northern region of our country. So, I was just giving example like sporotrichosis. Uh, that used to be very rarely we used to see, but we used to see every year one or two cases. So, I collected all the data of the last 10 years, and I found that almost 90% cases were coming from one province, which is called Himachal Pradesh, just adjacent to our city. So that time, one of the scientists, or I would say research student, came who wanted to do research. I said, "Can you do this research?" What is the research? Research is that you have to do every village in that whole province, you have to do a random sampling, and you have to go do the skin test. Skin test is porotikin, and I prepared that antigen ourselves in the laboratory, and which have been tested first, pyrogen test, then toxicity test. And so there was no reagent available. So that was the reagent which we developed. One bit crude, another is the very purified peptidoglycomanan, the antigen which is being prepared in it. So this fellow was very sincere and hardworking. He used to go to the village head and he used to say that I am coming from PGI. PGI had got a lot of respect in that region. Not only in that region, in whole of the North India, PGI doctors are recognized as a very sincere doctors. So he convinced that this is one disease we are studying and we need to do the skin test. It's so difficult for a normal, healthy individual to do skin test and observing for 48 hours. So he did this test and I went there and also helped him. And, by this way, we found that one particular region of Himachal Pradesh has got very high skin test positive. So what we did is that we then trained all the local physicians how to diagnose or what are the clinical presentation of sporotrichosis. So they and it said that if you have a case, you just let us know. So we used to take the biopsy and get the diagnosis. Within no time, we have got 50 cases in that area. In case of the treatment, we found that that time itraconazole was not available, or it's only a research compound which was there. It was not so easily accessible. So saturated solution of potassium iodide was the treatment of choice. So what we did is that we prepared saturated solution of potassium iodide in our laboratory, distributed to all the doctors. And because of this, case number fell very easily. And these are the patients, they were suffering for 5-6 years because they were having these skin lesions. For this, antibiotics were given. Usually, additional bacterial infection which are being taken care, but fungal infection was persisting. So it was almost 5 to 6 years each of these patients were suffering. So this is one disease which really helped in the local area. Then we had looked into that time Cryptococcus. We had also, because besides Neoformans, variant Gattai was there. By that time, David Ellis had shown in case of the eucalyptus tree, this is the particular where you can see the Gattai agent. So we also looked into whole area of Punjab and identified some of the trees where this is being there. Third thing, that time the research which we started working is the fungal sinusitis. And this fungal sinusitis was a major important challenge to us because so many people, in case of the villagers, they usually suffer from this disease. And that time categorization was the problem. So we developed a working group in this area, and that really had the development of the categorization, the definition of the defined types. That is still persisting, that definition. We are now planning for another workshop to redefine certain gap area. So this is the three disease which made our laboratory important. So by that time also we were giving the training across the different people. So there were laboratories were coming up across the country in different places. So I started thinking that we should start doing more of a incidence and prevalence study in multi-center way. It's a very good collaboration which happened, and everybody supported in it. We could do many in case of the, say, candida, what are the species, what are the incidents, all these things we could look into it. Similarly, in case of aspergillus and mucor, which we could do. So I would say that development of the laboratories, collaborating with them, that really helped us in building up the research in case of fungal disease here. So our stress was more in case of epidemiology rather than doing pathogenesis or other studies. Of course, we worked in case of the fungal sinusitis pathogenesis study, and of course in mucormycosis also. But that was the area I would say that mapping of the fungal disease was very important.
So following that trajectory of the past, the almost distant past, and all the way to the present, so I would be, and the audience will be highly interested, I guess, in talking about the future of medical mycology with patient centricity, for example, which is, I wouldn't say a new concept, but getting more focused. So medical mycology has changed and grew so much over the 4 decades that you are part of it and a pioneer in it. So, in your opinion, what needs to remain constant, and how do we work to assure that we keep the focus? Do you envision a need for more interdisciplinary work or for multidisciplinary care? Organ host or fungal clinical care and research. It's a broad field, but maybe you can give us advice and speculate a bit on this.
You know, Dr. Oliver, we had challenge in every area. We thought of making different different bodies which can help us in doing the collaboration in case of training and all this. So we developed one Indian Society of Medical Mycologists, one body. Second is that we developed a trust for doing the educational study and training and research, that is Fungal Infection Study Forum, which is having got 16 clinicians from the different discipline who are attracted to work in fungal disease across the country. So that was one thing which you could develop. And then there is another facility which you could do is that in case of Southeast Asia, not only Southeast Asia, it's also Asian country, we developed the Asian Fungal Working Group, which have been worked under our international society. I would say Dr. David Ellis helped us a lot because that time he was the ISHAM president and he really helped in this area also. So I'm saying these bodies, first thing is that helped in case of training, in case of research, in case of having the different aspect of fungal infection to look into. But you know, if we see, still in case of the fungal disease, awareness is still a major problem. It's not that the PGI, every center is having similar awareness as it is in PGI. It is not being the same pattern has been seen in many places. So awareness issue is a very important factor. And because we are in the tropical region, we have very high incidence of fungal infection. compared to your developed countries and all this which is being there. And moreover, in fungal disease, till now, 50% patients in invasive fungal disease, they die without knowing that they had fungal infection. And even after giving therapy, that's so there are plentiful areas in case of the fungal disease to do research. But what I push more in case of this is that mapping of the fungal disease so that at least we know what are the real targeted area where we need to work. Second important thing is that development of more laboratories, and especially with the reference laboratories where ICMR helped me a lot in this. So Indian Council of Medical Research helped in this aspect. Third thing is that in case of this is training. So training is one of the important component which we did in case of the WHO helped us, in case of our ICMR helped us, in case of different bodies helped us in this aspect. So I would say that we have plenty of gap areas in fungal disease in case of diagnosis, in case of therapy, and in case of the newer fungal disease which are coming up, how to pick up quickly and do this. So there are plentiful area for looking into this fungal infection. But at the same time, we need international collaboration. International collaboration we need it because we need advocacy. That though WHO has accepted certain diagnostic test as an essential test, certain medicine as an essential medicine, but the thing is that it's not available in most of the country. So that's the major challenge in this aspect. When we did a survey in case of our Asian laboratories, we found that less than 25% laboratories, they do non-culture diagnosis. So mostly it is only direct microscopy and culture. So we need to develop in this area. But I would say I am now thinking a very big way, which is very important in case of fungal disease, is that other than medical field, we need to work with the agriculturist, we need to work with the especially biologists, and also in case of the environmentalists. The reason I am saying you that the fungal kingdom as such, it has got threat as well as opportunities. We need to exploit both sides. That now we are seeing so many crops are being destroyed. Certain fungal disease which have been seen in case of the agriculture, in case of the different insects, animals, as well as human, like cryptococcus, like aspergillus. So what is the interplay? That is very important to know about it. That's a very important issue which is coming up in my feeling that would be very important. So if we can work together, all this discipline in this field, those who are medicine people, the people from the agriculture as well as from the biologist and molecular biologist also together. So this is, I feel that international collaboration and national collaboration, all this would be important in going ahead in this area of research. At the same time, fungus is not always harmful. Fungal has a lot of opportunities. So you can also think about what the opportunities in case of fungus, which can work together in this aspect. So that would be very useful, I feel, in this aspect.
It's highly inspiring and very important advice of what the next steps are and which direction we need to go together. So another red thread, except for besides communication skills, is leadership, and that is basically the next topic that I would love to ask you about and hear your thoughts. So, and in your pioneering mycology career, which leaders, past or present, influence your own leadership style and goals? And does modern academia need to better address intergenerational communication among faculty and support better female faculty than maybe it has been done in the past, irrespective of the different career stages? So what is your advice to all these individuals? And what is your mentorship philosophy? and what is your experience in leading mycology organizations?
This is a very tough question. Tough question. Why I'm saying you, leaders are, whether it is, always I have debated myself whether leaders are born or leaders are trained. So this point is always been in me thinking about this aspect. But I think that certainly some people have got more quality of giving leadership because they understand management and all those issues better. But at the same time, anyone can develop or train himself to become a leader. First quality I feel is that you have to be commitment to that area. You have to love to work in that area. That is first important quality which would be required. Second, you should acquire the knowledge in that area. That's very important to have this. Then you have to have this means capability or mentality to include the people, and the people should rely you. It's not that you exploit the people, rather you help the people. That is very important point. Then the people really come and help you, and you should know about the weakness as well as strength of the people whom you want to give leadership, so that you can put them in the right position. These are the qualities which are required, and I think I don't know how these things can be, whether they can be trained in this aspect. Yes, nowadays management training is there, and management training gives the quality how the leadership can be developed. But this is very important, that you have to be sincere, hardworking, committed. You have to have knowledge in that area. You have to love the people whom you are involving them, and they should rely you. That is very important. You should not exploit them, rather you should help them. Then at least whenever I planned a multi-center study, everybody wants to do or combine with me in this aspect, because I honored each of my collaborators. That's I feel most important in this aspect. But the mentorship wise, I will say that yes, I didn't get any godfather, but the way I learned, that can help in case of the young people to go along with. Another important character I missed, that is, you should have transparency in the work. Integrity and transparency is very important issue. I had to remove one of my PhD student when I found one data had been manipulated. I just asked him, you resign and go. So this is very, very important, that especially in case of this developing country where there is always challenge we face. So this integrity and transparency is very important.
So another aspect that I would like to hear from you about is, what is the most notable accomplishments that you are proud of?
When I see now across the country, so many people are jumping and working in case of fungal disease. Second important thing, whenever there is any conference, whether it is a critical care conference, whether it's a pulmonary medicine conference, whether it is a internal medicine conference, whether in each conference there is always now a session for fungal disease. That's a very important thing which happened. It shows that there is a rise in awareness which is there. Next, when I see that people are getting so much interested in case of fungal disease, they all are flocking into this subject. I always say that, look, compared to your bacteria, compared to your virus, if you work in case of fungal disease, you get the publication much commonly in the international good journal. The reason is there are very few people working in this area. So the people flock into this aspect. That's very, very important, which have been there. And always I'm proud of my younger colleague who really had come up such way. And you came and reviewed our center and given the diamond status. That's a very important factor and given a big impetus in case of our center.
So, so is there any mistakes that you made during the last 40 years and that you
No,
and that made you learn something so that you could avoid and that helped you develop?
as I was not having any not working under any leader, uh, always it was a chance that I did so many mistakes. Mistakes means not planning in a proper way of going ahead with it or something like that. So, though, as I've said, I have got lot. I'm really blessed because a lot of people helped me. I can name them like Glenn Evans. At my very early age, he developed a project to British Council between his center at Leeds with our PGI center. Then there was V.I. Mathan. He was a gastroenterologist, and he was the first time who came for this evaluation of our Center for Advanced Research, and who gave me 3 times of the money which I have asked for. Then I would say my own director, K.K. Talwar, who really has given me really enough opportunities to work with it. And because of him, I could get the WHO Collaborating Center. And of course, I learned the integrity, research, and diagnosis from K.C. Agarwal, who was the head when I was doing MD in microbiology. So these are the people who really helped, and they had in each area, whenever I did some mistake, they had pinpointed that you please correct this aspect. Like even Dr. K.C. Agarwal, when I was already professor, he came and suddenly said, your presentation today was very fast. You thought that everybody knows mycology. That was not. There are so many people who are there who are not knowing mycology. So you start speaking slow and you try to explain. You see, that time I am already professor. So this way I got the so much help from those people. I would say that mistakes are always there, but I learn from the mistakes.
And it's so important that even being advanced in a career, that there are still people who dare to tell you when things were not ideal. So that's a but that doesn't happen to each and everybody. So you need to be open to it and yeah, accept such constructive criticism, right? So, any other insights or advice that you would give to a junior person starting a career in mycology?
I would say I can give one example. You already know Dr. Ritesh Agarwal. Dr. Ritesh is a brilliant person. In case of India, there is very much competition in case of the medicine to get post-graduation. And Ritesh, in the competition, was first in both PGI Chandigarh as well as All India Institute New Delhi, both the premier institute. But he chose PGI because PGI has got a better postgraduate training. And by the way, he qualified and did the DM in case of pulmonary medicine. And following that, he thought that he will do research. So he asked his head of department, I want to do more research rather than doing in case of the clinical work. Of course, I'll do clinical work, but I need to uh, emphasize my work in case of research. So his head of department said that you go to Dr. Chakrabarti. And he said, why? He is very much, he never loves. He always been very disciplined person. I am scared of it. so, but the Ritesh came. I said, Ritesh, look, you have to do research like this step by step. I would really help you in progress of it, but you have to identify one specific area. And India has got the best award is the Bhatnagar Award. Bhatnagar Award has to be given to a person who is less than 45 years and did pioneering research work in this area. And All India Institute, New Delhi had got 3 Bhatnagar awardees, but PG has no Bhatnagar awardee. I was shortlisted, but I never knew that Bhatnagar award is so important and something is there. I only came to know when I was already 45 years. So I said, Ritesh, now you are 33, and I have to make you as a Bhatnagar awardee. So, this fellow step by step worked in case of the allergic, ABP, allergic bronchopulmonary aspergillosis, where he is now the international authority. And because of his work, he first got the Bhatnagar Award. And, he came running to my office, and we really both cried like anything. The emotion went in such a way that he got the award and I was facilitated to a certain extent. I am now nurturing 2 more persons to be like that research award in that sense. So I'm saying these are the real proud moment in the life,
Yes.
which you could not get. Your younger colleague got it. So that's very proud moment in that sense.
Well, thank you very much for sharing this very personal story. And yes, it is good advice, and it tells us something. So, any other useful stories you want to share with us?
There are so many stories in case of life, but I have enough already spoken about this area. So I think let it be here, because there are a lot of emotion and things are there in each area where we have really worked in this aspect. So many patient issue came. I can tell you a small thing, like suppose I had a house in Himachal Pradesh now, and when in that house, when I went for registration of the house, the Tehsildar, who usually do this registration, he asked me, generally, people feel that Tehsildar takes money for registration. But Tehsildar said, no, you have to have first 2 switches before you sign for the registration. I said, why? He said, the disease which I was suffering, he was suffering from, I think it was mucordiosis. Nobody could pick up that time. And really, he was suffering for almost 6 months. Like, it was that it has not gone to the CNS, but he was got a lung which was badly affected. So I could pick up this diagnosis, because that time it was not so known, and he became all right because of that diagnosis. So these are the things, I never knew him, but he remembered me so much that he asked me that you have to take sweets first before signing this aspect. So these are the way I got so many patients, blessings, love, affection, and also my students. Oliver, when I retired, all my students who have gone out, they have now established in different areas. They had made a my size of picture, this photograph, and collages with their photograph. It's a very unique one. It's a mind which they have played in this aspect, which I have kept in our house. Everybody says, who have done it? Who have done it? So I'm saying, this is the love of your students, love to your colleagues. It is the very important thing which I got working in PGI. I would never say that I am an average person, but I got everything because of the institute, because of my colleagues, because of my students. All these things happened in my life.
Wonderful. Thank you so much. So, if you mind, if you don't mind sharing with the audience, what is now ahead for you? What is ahead of you?
I am already reaching close to 70 years. So I think I don't know how long I am going to live, but I am still healthy and can really help the people. So I generally don't go and interfere in their work. But whenever they feel that it is required, they come to me. And I am doing the mentorship program across India. in developing the laboratories, giving the training and all these aspects. This way, I would say that people love me, and this way I am helping them in the mentorship program. I didn't take any job. I was having many job offer, post-retirement. I felt that my pension is enough for me, so I can work more independently. So I'm going in that sense. I'm doing many research, planning, and doing the research. As I said, I'm seriously thinking for this fungal kingdom, having got all the people together. If we can work on this aspect, that would be very important.
Yes.
So something like this I am planning in this aspect. So in case of the developing the more younger people, and at the same time doing the research management in that sense, I would say that is going on.
Yeah. Well, thank you so much for sharing all your thoughts and your experience. Dr. Chakrabarti, we are really grateful that you decided to do so and to give us these lessons and share them with the mycology community. And our goal is clear. It is to inspire young mycologists to dedicate their energy to our fascinating field and one day become pioneers in mycology. And apparently one can spend almost a life in mycology without losing energy, but it's we can see that, we can witness it from our conversation. So thank you very, very much for all your help and wishing you all the best.
Thank you, Oliver, for giving me this opportunity for speaking. So it's my really life story, which I try to give you in that sense. Thank you very much.
Thank you. Thank you.